Have you ever felt alone in a crowded room? That gnawing emptiness that creeps in, even when surrounded by people? You're not alone in feeling alone. Loneliness is a silent epidemic sweeping across our hyperconnected world, affecting millions. But what if I told you it's more than just a feeling, it's a health crisis that's costing lives? Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. Today, we're diving deep into a topic that touches us all, loneliness. But before we begin, let's clear up a common misconception. Loneliness isn't just about being physically alone. It's an emotional state, a feeling of disconnection that can persist even in the company of others. This distinction is crucial because many of us might be experiencing loneliness without even realizing it. To understand the scale of this issue, let's look at some sobering statistics. In the United States, nearly half of all adults report feeling lonely sometimes or always. The UK isn't far behind, with about a third of its population experiencing chronic loneliness. In Canada and Australia, the numbers tell a similar story, with millions reporting persistent feelings of isolation. But why should we care about loneliness beyond it being an unpleasant feeling? The answer lies in its profound impact on our health. Loneliness doesn't just affect our mood, it can literally make us sick. Studies have shown that chronic loneliness increases the risk of depression, anxiety, and even suicidal thoughts. It's not just our mental health at stake, our physical well-being suffers too. Loneliness weakens our immune system, making us more susceptible to illnesses. It increases the risk of heart disease, accelerates cognitive decline, and can even lead to premature death. In fact, researchers have found that the health impact of chronic loneliness is comparable to smoking 15 cigarettes a day or being obese. Let that sink in for a moment. The feeling of being disconnected from others is as harmful to our bodies as some of the most well-known health risks. So why is loneliness on the rise in our hyperconnected world? The answer lies in the very fabric of our modern lifestyle. Remote work, while offering flexibility, has reduced face-to-face interactions. Digital communication, for all its convenience, often lacks the depth of in-person connections. We're more connected than ever, yet paradoxically more isolated. The decline of traditional family and community ties plays a significant role too. As we move away from our hometowns for work or study, we leave behind established support networks. And then there's the social media paradox. Platforms designed to connect us often leave us feeling more alone than ever. We scroll through carefully curated highlights of others' lives, comparing them to our own unfiltered reality. The cost of this loneliness epidemic extends far beyond individual suffering. It's taking a toll on our society as a whole. In the workplace, loneliness leads to decreased productivity and increased absenteeism. Healthcare systems are straining under the weight of loneliness-related diseases. And the impact isn't uniform across age groups. While loneliness affects people of all ages, its manifestation and consequences differ between youth and older adults. Interestingly, the experience of loneliness isn't uniform across cultures. Western societies, with their emphasis on individualism, often report higher levels of loneliness compared to more collectivist Eastern cultures. But make no mistake, loneliness is a global issue. Case studies from the US, UK, and Australia reveal similar patterns of increasing isolation, despite cultural differences. So, what can we do about this growing crisis? The solutions need to be as multifaceted as the problem itself. On an individual level, practices like mindfulness can help us become more aware of our emotional states and needs. Volunteering and joining community groups can provide a sense of purpose and connection. These aren't just feel-good suggestions, they're backed by research showing their effectiveness in combating loneliness. At a community level, we need to rethink how we design our public spaces. Cities that prioritize communal areas and facilitate social interactions can help foster a sense of belonging. Local initiatives that bring people together, from community gardens to neighborhood watch programs, can rebuild the social fabric that's been fraying. Even governments are starting to take notice. The UK made headlines by appointing a minister for loneliness, a move that underscores the seriousness of this issue. While it might sound unusual, it's a recognition that loneliness is a public health crisis that requires policy-level interventions. But what can you do today, right now, to combat loneliness, whether for yourself or others? Start small. Pick up the phone and call a friend you haven't spoken to in a while. Reduce your scrolling time and seek out face-to-face interactions instead. Join a club or group that aligns with your interests. These small actions can have a ripple effect, not just in your life but in your community. Take a moment for self-reflection. When was the last time you felt truly connected? What activities or relationships in your life bring you a sense of belonging? Understanding your own experiences with loneliness is the first step in addressing it. As we wrap up, it's crucial to reframe how we think about loneliness. It's not just a personal problem, it's a public health crisis that affects us all. Left unchecked, it has the power to undermine the very foundations of our society. But the good news is, we have the power to change this trajectory. So, I want to hear from you. What do you think is the biggest cause of loneliness today? Share your thoughts in the comments below. Your perspective could help others feel less alone and spark important conversations. If you found this video helpful, please give it a like and consider subscribing to our channel for more insights on mental health and well-being. Remember, your journey to a healthier mind starts here, and together, we can build a more connected world.